Hi, and welcome to Hill and Ponton's VA Disability blog. Today we're going to be talking about pyramiding. When pyramiding is used in VA disability claims, some examples of the same, sometimes when it's applied and it shouldn't be, and quite frankly, what is it before we even get to that? So if you join us, you'll get all of that information and more. Thanks. Hi, and welcome to Hill and Ponton's VA Disability blog. I'm Natalia Joffrey, the company COO.
And I'm attorney Rachel Cheek.
Hi, Rachel.
Hi.
So as you can see, Rachel and I, we're still social distancing. And we didn't address this in our last video. We do hope to eventually be in the same room again, but for now, we're going to continue to do our videos this way just so we can put that this information out there. Today's topic, Rachel, I am completely unfamiliar with this, so you're going to educate us all on
Got it.
What pyramiding is. I've never heard of this. So can you tell us basically what pyramiding is in VA disability claim?
Sure. So when you see pyramiding, it's a good name, as you'll see. This applies to the practice of essentially what the VA wants to avoid, which is assigning ratings for the same symptoms multiple times. So example would be nice, right?
Yeah.
One thing that I see a lot, veterans claiming things for, say, service connection for PTSD. They get service connection for PTSD, then they want to claim service connection for depression or service connection for anxiety or for sleep problems, all of which are symptoms of PTSD and all of which are absolutely things that can be caused by PTSD. But the symptoms that come from those conditions are rated under the same diagnostic criteria as PTSD. So, for example, when you're getting rated for a mental condition, whether it's depression, anxiety, PTSD, adjustment disorder, anything like that, the symptoms that VA looks at to determine how severe your condition is, they're all the same for basically all of those mental conditions. So the VA is not going to give you a 50% rating for depression and a 70% rating for PTSD. What they're going to do is look at, all the conditions that you have that are service connected, and they're going to look at what's the highest rating that you can get from one of these, whatever one of these disabilities that have similar symptoms, and they'll give you the highest rating. So, for example, say, I'll keep going with the mental disorder example.
Yes, because I think that's a great example.
Yeah, and that's something I see a lot.
That we can understand how these overlap. Because like you're saying, where do you separate the disorder or the disability from the symptoms, I guess. Yes.
And so, for example, say you have a diagnosis of PTSD and a diagnosis of depression. I see that all the time. Your PTSD causes irritability with angry outbursts. It causes you to, be hyper irritable and get angry and punch the walls and kick things when you're mad. Well, that's a symptom that would be rated under 70% in the criteria that I'm talking about. Well, say your depression causes you to sometimes be unreliable at work, or sometimes periodically you'll have you'll have sleep impairment, or your mood will be affected. Well, those are going to be symptoms that are rated under the 50% or the 30% category of those mental disorders, right? You're not going to get separate ratings for each symptom because those are all rated under the same criteria. Even though, yes, you have depression due to your service, and yes, you have PTSD due to your service, they're going to rate it based on the highest symptoms. So they're going to look at those that irritability and angry outbursts that come from your PTSD. And what they're supposed to do is look for whatever could get you the most compensation. That's what you're supposed to be rated under. And I have some other examples that as we go, I'll hopefully help clear things up a little bit.
So you mentioned ratings, and you mentioned them picking which one the symptoms. So of course, you know what I'm going to ask you next. Do they often get it wrong? Do they often assign the wrong ratings.
Oh, for sure. I mean, that's
Yeah.
why we're in business. VA, yeah,
Unfortunately or fortunately, but yes.
yeah, yeah.
So
Um,
they, okay, go ahead. Sorry.
Yeah, so they will either often get it wrong or they won't apply. They'll apply the criteria incorrectly. The VA is very afraid of pyramiding. They don't want to overcompensate for the same symptoms, which on one hand is understandable. You know, you want to be compensated for what's actually happening, but on the other hand, I always think, come on, err on the benefit of doubt. You know,
Yeah.
give the vets the benefit of doubt. You know.
Right.
Um, so there's a lot of cases where additional ratings should be assigned and they're not because the VA is worried about pyramiding.
Okay. And so they're saying we're just going to give you this for PTSD and we're just going to pretend this depression, anxiety, or whatever else isn't even going on.
No, I mean they will. That one's not an issue. That's an actual fair fair way to avoid pyramiding. So I'll give you an example. One would be, oh, a good one. We've talked about this before, I think. So for your knee, say you have a knee disability, you can be rated based on the limitation of the range of motion. That's a very common way to be rated.
Mm-hmm.
And the more you're limited, the higher your rating is. But you can also be rated separately for instability of the knee. And so that's if, I mean, I don't really know how to better explain that. If your knee is unstable, you know, you can't, it slips out a lot, you know, you find yourself falling over or, you know, you don't feel very stable on the knee. Even though those symptoms might come from the same condition, say you have, you know, degenerative arthritis of the knee, and that's, you know, what causes it. It causes both your limitation of motion and your instability. Those are two distinct and separate symptoms.
Mm-hmm.
What the VA is required to do is compensate you based on the symptoms that you're having. So even if you have, you know, one single condition that causes multiple symptoms, the VA is required to look at all of those symptoms. And if you're able to get a separate rating for that, they should. That's something that they should look into. And they don't a lot. I do see that on exams. Again, for the knee, you know, they'll note the range of motion loss, and that seems to be where the raters just stop and say, okay, well, let's, you know, give the vet a rating based on that. But they don't look and see where the examiner noted that there's instability of the knee or something like that.
Okay.
Another example, keeping with knee, I'll show you an example that would be pyramiding. Mm-hmm. You are allowed to have, even if you don't have limitation of motion that falls within the range that the VA will compensate you for. Mm-hmm. If you have pain upon movement and your service connected for this condition, you can get at least a 10% rating. So even though, say, you have your full range of motion, you know, there's nothing stopping you. If it's painful, you can get a 10% rating. However, if it's painful and your motion is limited, you can't bend it all the way, you know, or you can't extend all the way, you can't bend, whatever, you're limited. You need to be rated on that limitation of motion rather than just the pain. Does that make sense?
It does, but I have to honestly say this seems like a very difficult concept to grasp. Mm-hmm. Like it seems like there's a lot of different levels and intricacies, and honestly, and this isn't a sales pitch, but if I were a veteran, I'd be like, let me just honestly, like if I come to you, you can figure this out, right? Whether it's being applied wrong, mm-hmm. or how to apply it right, or what I should be getting based on what, because this is to me, seems like a very complex concept.
It is. It can be. You have to be familiar with each of the conditions, or if not familiar, you have to go, you know, look them up and see, because the rating tables are there online for anyone to see how conditions and which level they're rated at. But you have to look at each specific one. They can be different. There can be little tweaks like that 10% rule for painful motion.
Yeah.
For example, it would be pyramiding. If you had a 10% rating for painful motion and a 20% rating for your loss of range of motion, you should be getting the higher one of those, because the symptoms are the same. It kind of prevents you from moving. You see how that's different than limitation of motion and instability. Those are two different symptoms.
Right.
That would
And
not
so
be permitting.
if you're handling the claim and I get a decision, you can figure out whether the decision is accurate, whether I'm maybe getting the most I should be getting, or whether we should be filing an appeal because the assessment that they made or the concept of pyramiding being applied is incorrect. I mean, you can help me figure that out and make a recommendation in terms of whether to pursue the claim further or if we've pretty much reached the maximum of what I can get in my case.
Yes.
Yeah.
Yes.
Okay. Any other thoughts on pyramiding that you maybe want to share?
Oh yeah, well I can give you another example of an argument I just wrote that went up to the Board of Veterans Appeals. I didn't know a whole lot about pyramiding before seeing it in practice. So it kind of helps to hear examples, right?
Yes, definitely.
So this is where I'm talking about where you want to, if you're looking at your rating, you want to make sure you're getting compensated. It's important to know all of the different symptoms and the way that they're rated for the VA. So for this case, we had a gentleman who has, he's rated for scars, service-connected for scars. He has scars of his face and of his body. Okay. So he was being rated based upon, the facial scars are rated based upon if they're disfiguring or not. So the way that they will consider that is your scarring symmetrical? If it's asymmetrical, it'll be, disfiguring, or if you have their deep scars, they'll be rated as, disfiguring. However, that is only one of the symptoms that you may have from a scar of the face. If your scars are painful or unstable, and unstable meaning that they don't heal all the way, that they'll break open, or it's just in kind of a constant state of healing and recovery, or if they're painful and they cause you pain, you can get a separate rating for that as well. And so for this instance, this veteran, he was only rated under the rating code, under the certain symptoms of disfiguring scars, because they were, asymmetrical or covered X amount of his face. Right. They weren't rated. However, he said, these scars are painful. They cause me, they hurt. This is another symptom that I'm having. I'm not being compensated for. And because that's in the VA regulations that you should be rated on all symptoms of your condition that are allowed, that's what we argued to the board. Yep, thank you so much for the rating for the disfiguring scars. However, you did not factor in the fact that they're painful, and he needs a separate rating for that as well. There was a similar argument we made on the scars of the body. So the scars of the body will be rated, not whether they're disfiguring, but on the area of surface of skin that they cover. And that's how his were rated. But again, the VA didn't take into account the fact that he had painful scars and unstable scars that wouldn't heal all the way. And he was entitled to another rating under the code based on that. And so that's an example of where I think the VA was probably afraid of pyramiding. So they avoided, they gave him ratings for his scars. So right. In a way, he was being compensated, but he wasn't being compensated for the full amount of benefits he was entitled to. I think it does come from a fear of, okay, we don't want to improperly apply this. I know we're not supposed to rate the same condition twice. So I think sometimes the VA raters don't necessarily grasp the concept. It is difficult. Yeah. And so that's something where their fear of pyramiding led to this man not being compensated for the full amount that he should be. And that's something where it just takes someone who knows what to look for, looking through your rating sheet, looking through your medical history, and just making sure that all of your symptoms are being compensated for, rather than just, the most severe, or just the ones that seem the easiest. Yeah. Right. One more example.
Okay.
Okay. I just want to give you.
I have to just say, I love the example you gave for so many reasons. One, I never knew that you could get benefits for scarring. I did not know that. Two, once you started talking about painful scarring, it was like, ding, oh yeah, that's right. My husband had an accident in his hand. It literally blew up. And it healed. I mean, he had reconstructive surgery and it healed, but to this day, certain, he'll have pain in his hand, and And it's like you described exactly. It is painful scarring. It's never going to get better. It's an ongoing problem. He's always going to have it. And it would have never occurred to me that, yes, not only should you get benefits for the scarring, and like you said, if it's in your face or whatever, if it's disfiguring, but also it can be painful. And then when you talked about scarring that doesn't heal, and people don't realize if you have diabetes, if you have certain anemic disorders and things of that nature, those scars don't ever heal properly. They continually reopen. You have to have wound care. It's not, you're always prone to infections. And so I have to just say kudos, because it's so nice to get an example where it's like, whoa, there, I mean, you basically just presented 3 different topics, 3 levels of benefits that you could potentially get that would have never occurred to me. And I think that that's where you come in, and that's where when you're talking about a person that knows what to look for, what to consider, and even like for this veteran, here he's getting a percentage, and I see that mistake made so often with veterans. It's like, well, this is what the VA gave me. I figure this is all I'm supposed to get. And that's really not the case. They get it wrong a lot.
Oh, yeah.
So anyway, I just wanted to talk because that you really just opened my eyes to like a whole other, level of claims. So
good.
Give us another example, because you're on a roll.
I'll do my best. No, but I think it is easier. It's easier to understand these concepts when you have specific examples. So that was an example where the VA seemed to maybe fear pyramiding, but pyramiding was not at play. Those are separate symptoms. I'll give you an example where that would be pyramiding. And this is also something that, I didn't know for a long time. So for example, say you have a back condition and it causes radiculopathy. Okay. Radiculopathy, pain, tingling, burning sensation, numbness, whatever, weird sensations in both of your legs. Okay. You know what? Let's make it easy. We'll say one leg. Say your left leg. Okay. So you have an exam for back conditions and radiculopathy, and the examiner will note. So radiculopathy is rated based on what nerve groups are involved. I'm not a physician. I'll give you the two ones that I can think off the top of my head, like sciatic and femoral. Those are 2 nerves that are located in your leg, and that can cause radiculopathy. So you can have more than one. You can have both of those nerves affected. However, the symptoms that are going to be caused by those nerves being affected are going to be similar. You're going to either have tingling, pain, burning, numbness. Something's going to be up with the sensation. You're not going to be able to be rated for both your left sciatic nerve and your left femoral nerve. What they're going to do, they're going to look at which of those nerves is most severely affected, and they're going to give you a rating for that one.
Okay.
Because unlike the scar example where you've got disfigurement and pain and instability, those are 3 separate symptoms. You're going to have the symptoms of tingling and burning or numbness regardless of, or from both of those conditions. Not, the doctor can't say, well, the femoral nerve's causing the burning and the sciatic nerve's causing the tingling. That can't be separated out. So that would be a case of pyramiding if the VA were to assign you a rating, a 20% rating for one nerve and a 20% rating for the other nerve. It doesn't work like that. What they're going to do is look and see which is most severely affected, or if they're the same, it doesn't really matter which one gets the rating.
Got to pick one.
Your rating. Yeah.
Yeah. That is another great example. Wow. Thank you, Rachel. This was super duper informative. So I'm so glad we talked about pyramiding today.
Yes. You learned a lot, right?
I really, really did. This was wonderful.
Good.
If you have questions or want additional information, please feel free to visit our website or call our office. Otherwise, we thank you for joining us.
Thanks.